So today we're working on pigmentation and epidermal melasma. And the way you differentiate between the two, dermal melasma and epidermal melasma, is you can see it on the surface. And if you look at the skin and you can almost pick off the pigmentation, the pigmented lesions here, that's when you can work on epidermal melasma. If it almost blends in with the natural color of our skin, which would usually be on a Fitzpatrick 4, 5, or 6, then often you don't want to work on the melasma itself because it will bring it to the surface with the IPL laser instead of actually bringing it off, which comes up like little coffee granules. So today we can see it's perfect. Her skin is light and her pigment is dark. So it's the perfect pigmentation to work on today. And she's recently had a baby, so she's got a little bit more melasma than normal. And with melasma, we have to stack on the treatment, or we have to stack with the treatment on the treated area. And sometimes you can use icing as well in between the passes. Okay. And she's a Fitzpatrick 3, but I'm going to treat her in a program 1 today. Her skin is very light. So we're going to just start on the bottom here, work our way up. After about 3 pulses, how are you feeling?
Pretty good.
Is that okay?
Yep.
Just hovering in the gel. You're going to treat the whole cheek, okay? Side, pulling up that pigmentation. And once we get actually on the melasma itself, we're going to do some stacking. Okay, so I'm going to stack on this pigment, stack on it again, up to 3 to 5 times. And you have a little bit of icing in between. That's why you have a cooling system with your laser, cooling the surrounding tissue. So you're just going after the chromophore at hand, which is pigmentation and melasma. Okay. So you're going to see it get darker right away. You want to see a light pink hue in the skin. And you can see her melasma is getting darker. The idea is to get it quite dark before she leaves at the end of the service today. I like to do 2 passes, some stacking on the melasma, then I go to the other side of the face to see what actually happens in the next few minutes, because it will get darker with time. Okay, just going to work on this side, turn your head this side, perfect. And you can always tell it's melasma because it usually mirrors each other on either side. So here's a little pigmented lesion and here's a pigmented lesion here. You're always going to have pigment on either sides of the face, the forehead, the upper lip, or the chin, sometimes the neck as well. And men can have melasma as well. And you're only getting rid of the superficial pigment. You will always have it lying in the dermis. And it comes out with natural sunlight, fluorescent lighting, even those office lights at work. It's important to use active ingredients post-treatments. Okay, and start down here again, both hands in the laser. You're doing okay? Yeah. Tough cookie here. That doesn't really, it's just a little pinching feeling, really. Now I'm getting closer to the eye, going to push away from the eye. And I'm just stacking on the melasma itself. Anywhere from 4 to 6 stacks. as long as it's a lighter Fitzpatrick. I'm not going to do this on darker skin. Okay, that's great. So you can see it's getting darker there. 1, 2, 3. 1, 2, 3. I'm going to finish my pass here. And I always count 1, 2, 3 when it's a bit of a sensitive area, or you're trying to warn your client that they have a higher pulse coming up. Away from the eye, 1, 2, 3. Okay, good. Finish the chin here. And always stay away from tattoo, whether it's permanent makeup. Make sure you don't go near permanent makeup. Okay, we come back to the side here, and you can see how her melasma is a little bit darker here. It's come up to the surface, tiny little coffee granules are already showing. I'm just going to go a little bit higher and stack again. 1, 2, 3. And you can do some icing as well. Use your handpiece or use actual ice if you'd like. And IPL is very safe. It's just a light source, okay? There's no real side effects to IPL. Good. I'm really going to make sure this comes up today because I know I like to bring this on off. Good. Okay, I'm going to go back to this side, see how much darker this is. And we're going to stack at a higher setting again. 1, 2, 3. And if the patient is more sensitive, you'd like to take a little break after 3 or 4 pulses. She's doing just fine. Often people would like a break. It's usually after about 4 pulses. Take a break, do a little icing. Now it seems like I'm doing quite a bit of stacking here today, but she's a lighter Fitzpatrick, so she can handle it. We're really trying to lift that pigmentation for her. It generally takes anywhere from 2 to 3 treatments to actually lift the pigmentation. And in between treatments, they're using active ingredients. I'm just pulling up the rest of the little freckles there. Okay, that's great. See how much darker it is? That's all going to come up to the surface in the next 3 to 4 days and start desquamating, shedding, and you're going to do light exfoliation at home. Okay?
Sounds good.
Good.